Welcome to Chapter 18, Part 8. This is the last recorded lecture in the heart physiology. And in this lecture, we will talk about some common heart conditions and disorders. So in this lecture, we will talk about coronary artery disease, myocardial infarction, congestive heart failure, arrhythmias and fibrillations, pericarditis, cardiac tamponade, valve disease, aortic aneurysm, and congenital heart conditions. So coronary artery disease is the leading cause of death in Americans and worldwide. You have probably heard this just referred to as heart disease or atherosclerosis, but CAD, coronary artery disease, specifically occurs when we have fat and cholesterol buildup in the walls of the arteries that supply the heart. So remember, the arteries are vessels that, like hollow tubes, that bring oxygen and nutrients to tissues. The coronary arteries specifically bring oxygen and nutrients to the cardiac muscle that makes up the heart. So as we have plaques, so just think of this as like the fatty gunk that can get in your plumbing if you're pouring bacon grease down the drain too often. And this can build up on the walls, which is going to impede the flow of blood to the heart muscle. So again, if we're not getting enough nutrients and oxygen to the heart muscle, then it's not going to be able to do its job as well. So we might see someone with early symptoms of coronary artery disease with chest pain. The fancy term for that is angina pectoris, and this will usually be radiating from the middle or left side of the chest, especially upon exertion. So that's kind of the warning sign. If you start to do heavy labor, maybe you're going to stack some wood or shovel some snow or lift some heavy boxes, and you have chest pain, but then it goes away when you sit down and rest, then we might want to get to the doctor to have your heart checked out to make sure that we're not having this buildup inside the vessels that are serving the heart. Many people do not have symptoms as this slow buildup occurs in the arteries in the heart. But if untreated, the coronary arteries will eventually become blocked, just like your kitchen pipes will eventually become blocked. And when that blockage occurs, we call that myocardial infarction, which is a heart attack, when blood flow stops to the heart muscle. Early on, when we start eating foods that are high in fat and otherwise, we will start seeing little fatty streaks occurring in the artery. So this can begin as early as childhood and then gradually progresses throughout life. Some risk factors include smoking. So smoking anything, not just cigarettes, is the number one preventable risk factor for heart disease. Additionally, a diet high in fat and cholesterol, which are your fried and processed foods, is going to provide that fat to deposit on your arteries. We know that there are some genetics and family history. So if you know that people in your family have had coronary artery disease or heart attack, then you are at a greater risk. Hypertension, which is high blood pressure, and high cholesterol, which is elevated levels of blood fats in your blood, put you at risk. Obesity is an independent risk factor. Additionally, high alcohol consumption. This is more than 2 drinks a day for a male or 1 drink per day per female. Lack of exercise, that means less than 150 minutes of exercise per week. So 30 minutes, 5 days a week. You want to be, it could be something as simple as walking or something more intense like cycling or going to the gym. Also, chronic stress is an independent risk factor for coronary artery disease. Myocardial infarction, so we just said this. This is what happens, the heart attack, when blood flow is blocked to a region of cardiac muscle cells. The blockage occurs with fatty plaques and cholesterol lining the walls until they block the vessel. Symptoms of heart attack vary between males and females. Males have the more typical crushing chest pain, difficulty breathing, sometimes pain radiating down left arm, sweating, sometimes nausea. But females have the more under the radar kinds of symptoms: nausea, pain in the jaw, sometimes pain radiating to the shoulder or between the shoulder blades, and then feelings of indigestion. So men have the more severe symptoms that often would prompt someone to call 911. Females have less severe that are sometimes just seen as exhaustion and often don't get the immediate treatment. So what do you do if you think someone's having a heart attack? If they are conscious, you give them aspirin, old-fashioned aspirin, not Tylenol, acetaminophen, ibuprofen, or anything like that. And then you would call 911. Risk factors for myocardial infarction include coronary artery disease that we just talked about. So the slow building up of fats in the vessels, smoking, elevated blood cholesterol. Does this all seem familiar? Uncontrolled high blood pressure, diabetes, obesity, lack of exercise, excessive alcohol, and additionally, overdose of substances, including heroines and opioids, as well as cocaine. Congestive heart failure is a different type of heart disease. This is a slow progressive condition where CO, that's cardiac output. So this is the amount of blood leaving the heart to go out to the tissues is so low that blood circulation is not getting the nutrients and oxygen to all of the tissues that we need. So this is body tissues, not just cardiac tissue. Congestive heart failure results from a weak heart, right? The myocardium is the layer of heart muscle. And when it is overworked and weakened, then it can no longer pump, and then cardiac output is reduced. Conditions that can weaken the heart muscle itself is atherosclerosis. These are the clogged arteries. Think about this. If your vessel is partially blocked by fatty buildup, your heart is going to have to pump harder to get the blood through that area. Persistent high blood pressure. So this is when your blood pressure remains elevated for chronically. So this is not just one day you had a bad day and it was high. This is the diastolic, so the bottom number, greater than 90 on multiple occasions. And again, it's just causing that myocardium to work harder. Hypertrophy is when we have to thicken that muscle layer to try to make it stronger, but this is not the good hypertrophy like you get with aerobic exercise. This is an inefficient thickening on one side of the heart versus the other, and it just causes irregular blood flow. Surviving a myocardial infarction. So surviving a heart attack is awesome, but if some of those cells died and were replaced with scar tissue, they can no longer pump the same as healthy heart tissue. So then we start seeing the heart getting weaker. And then we can also have something called dilated cardiomyopathy, where the ventricles are stretching and become flabby and weak. And then we have a breakdown of the myocardial tissue. This can be a result of many things. Also, this can happen because of the blood pressure, diabetes, drug toxicity, or chronic inflammation. Either side of the heart can be affected by congestive heart failure. So left-sided failure means that we're going to have a backup of blood into the lungs, and that's going to cause swelling, edema in the pulmonary vessels and the pulmonary tissues. So blood backs up to the lungs. Right-sided failure results in peripheral edema. That means that blood and fluid is pooling in the extremities, the hands, and the feet, causing edema there because the right side of the heart is unable to pump as strong as it needs to. So it backs up the blood coming back to the heart. Obviously, if one side of the heart becomes weak, the other is going to weaken over time as well. So then we just end up with one weak heart overall, and fluid buildup in the tissues and the lungs. So we're going to try to remove the fluid. We might see some drugs to diurese and pull some of the fluid out. But there's not a lot we can do. We can't make this heart tissue strong again. In some cases, we might be able to get a heart transplant, but it is usually a slow road to death. Okay, so another kind of heart disorder are conduction disorders. So these are kind of, think about these as electrical blips. So we can have arrhythmias, which we just call irregular heart rhythms. They are uncoordinated, and they can range anywhere from mild to severe. Fibrillations, you may have heard of AFib or VFib if you watch commercials or watch doctor shows. So AFib is the less serious. These are irregular heart contractions. You can often feel them as flutters, and they can happen when your thyroid hormones are out of whack, if you have an excessive amount of caffeine. They happen in diabetics. Sleep apnea is when you stop breathing during the night, metabolic syndrome, or stress. Usually we have decent heart pumping and circulation with AFib, but we want to continue to watch that to make sure it doesn't become more serious. VFib is the dangerous one. This is the one on your doctor shows when you see them say, he's in VFib, grab the paddles. So basically, when we have irregular contractions in the pumping chambers, in the ventricles, then we have just this inefficient back and forth kind of flow of blood, which does not lead to circulation and can cause sudden death. Sometimes we can fix this with defibrillation. So this is when we grab the AED and we kind of shock the heart back into normal rhythms. A heart block is when that AV node is defective. So it can't send the message through the AV node, and so we don't get a lot of pulses that reach the ventricles. Without the direction from the AV node, the ventricles are going to beat at their own rate, which is only about 30 times a minute, which is not enough. It doesn't cause immediate death, but it's not enough to maintain circulation to the body, and we have to fix it. And we can often do that by putting in an artificial pacemaker. So this thing that we see under the skin right here is a pacemaker, and it's going to take over the job of the AV node and tell the heart when to fire. Okay, pericarditis, anything that ends in itis, is an inflammation. So this is an inflammation of the sac that the heart sits in. These can be caused by viruses or autoimmune causes. And essentially what we're going to see is that we have inflammation between these two layers. We can also have some swelling and friction, so it hurts. It kind of feels like the outside of your heart is being rubbed raw. The pain is felt right below your sternum, which is your breastbone, because that's where this pericardial sac is. And every time you breathe in and out, it will become sharper. Most cases of pericarditis resolve on their own. Sometimes we'll have to use medicine, and very severe cases we'll have to do surgery. Cardiac tamponade is the heart plug that we had talked about earlier. This is when that space between the two layers of the pericardium becomes full of fluid. That can be tissue fluid, but often it is blood. And so imagine the heart sits in this sac, and if the sac is full of fluid, the heart can no longer expand and contract, so it can move blood throughout the body. The bleeding or accumulation of fluid usually happens after trauma to the chest, so a car accident or something where we're going to have damage to that heart tissue, or severe pericarditis can cause this as well. If we don't treat it, the fluid will continue to build up and the heart will stop beating, and that will lead to death. We can treat this by going in with a syringe, so a big long needle, into that heart sac cavity, right? The space between the visceral and parietal pericardium, and then drawing out the fluid. And then usually your patient will have immediate relief when that fluid comes out. Okay, valve disease. We have two different kinds of valves. So we have leaky valves that don't close. We call those incompetent valves. And if the valves are not closing, then blood is backflowing and the heart is pumping the same blood over and over. It's not moving along and getting to the tissues where it needs to go. Incompetent valves are valves that don't close correctly. Valvular stenosis is when the valves become stiff and are unable to open fully. And now the heart is going to have to work extra hard to pump the blood against that friction and pressure. So usually we will replace the valves. This has become fairly routine, and we can replace it with a mechanical valve. We also have some animal valves. These are pig valves, or we can use a cadaver valve. Aortic aneurysm. So an aneurysm is a bulge like this. This is in the descending aorta, but this can also occur in the aortic arch. So when we have continuous high pressure, that can create this bulge in the aorta. We usually see that with poorly controlled blood pressure over a long time. Sometimes it can happen acutely with an infection. We also see when we have the cholesterol plaques building up in the arteries, now the heart is having to pump harder, and then that can cause this weakness and bulge in the vessel. So an aneurysm is this bulge. It often comes without symptoms or with vague symptoms: chest pain, back pain, coughing, shortness of breath, sometimes difficulty swallowing, depending on the location. Because this bulge has a thinner wall, it is at risk of rupturing. And when your aorta ruptures, you are a ticking time bomb. We have got to get you to emergency surgery, because the aorta is remember, this is where the blood leaves the heart into the aortic arch, and then it's going to go down this descending aorta. So if we have a hole in that main vessel, we can bleed out very, very quickly. So we have to get to the hospital immediately when that ruptures. Hopefully we can identify these vessels when they are only in the aneurysm stage before they rupture, and then we can treat them. Okay, and congenital heart conditions. So these are conditions that babies are born with. We learned about the foramen ovale, which is this opening between the right and left atria in a fetus. So when fetus is in utero, fetal lungs are not working. So this makes sense. The blood does not go into the ventricle and go to the lungs, because the lungs are not even inflated yet. So we use this little shunt to go over here to the left atrium, left ventricle, and then we pump this blood out. Because remember, in a fetus, the blood exchange is happening at the placenta from mom, so the lungs are not functioning. Normally, this opening should close shortly after birth, But in the case of patent foramen ovale, patent just means open. It does not close. So we have this opening continuing after the baby is born. And that's going to cause a mixing of oxygenated and deoxygenated blood, which decreases the amount of oxygen available to tissue. So often you may hear of a baby having to have a surgery to repair the hole in their heart. This is where this would be happening at the foramen ovale. Because normally foramen ovale shortly after birth will close up and be covered with connective tissue, and then we call that the fossa ovalis. So fossa ovalis is the structure in the adult, but in these kids with the patent foramen ovale, they do not have a fossa ovalis that forms. They have a hole here, and so we have this constant mixing. Okay, here's just some pictures of the heart disease. So you can see the valve disease, where the valvular stenosis is the stiff valves. Here's the aortic aneurysm, this bubble right here. Here's coronary artery disease, where we have the accumulation of plaques on the walls. The arrhythmias, remember, these are electrical, not structural, where the firing rate of those impulses are altered. Heart failure, where this wall becomes flabby and can't do its job. Cardiomyopathy, where it becomes too thick because it's been pumping against greater pressure, and now we have an unequal flow of blood. And then pericarditis is the inflammation of the pericardial sac that holds the heart. A couple bits about development of the heart. So in a fetus, we have a single pumping chamber about 3 weeks in. Slowly, that heart tube is going to contort and then look like 4 tubes by about 10 weeks. Then we're going to see the chambers distinguish and the valves form and are functional somewhere in the 17 to 20 weeks of pregnancy. So when we hear the early fetal heart rate, that is the electrical activity. That is not the pumping of the chambers and the opening and the closing of the heart valves that we would hear as heart sounds in someone with a fully developed heart. We talked about the foramen ovale connecting the atria. We also have that ductus arteriosus that connects the pulmonary trunk to the aorta. Both of these bypass the fetal lungs that are non-functional and should close shortly after birth. As we get older, we know that the heart muscle is kind of a use it or lose it. So we do know that you need to regularly exercise your heart. Again, you don't have to be running 50 miles. This is 30 minutes of brisk walking 5 days a week. When we do that over time and with plenty of miles, then we see a healthy heart. Heart disease is not given as you get older. If you take care of your heart, it can last a long time. Excuse me. Did I mean to say? But if we don't use that heart muscle, it becomes flabby and doesn't work very well. Sclerosis means it gets thick and hard. These valve flaps, they're not going to move the blood like we need to. The heart becomes less efficient. The muscle can be stiffened. And then we have the hardening of the arteries. We do know that what you feed yourself and how much you move and exercise can maintain a healthy heart for a very long time.